So I recently had a question from someone that wanted to know, can I do keto if I am on medications? Now, it's kind of a broad question. Someone can be on a lot of different medications, so it really depends on what medications you're talking about. But because keto has this huge effect on lowering insulin, and so many health conditions are connected to high levels of insulin, so generally speaking, the need to lower your medication is going to be very, very high, because insulin's connected with so many things. So for example, if you have high insulin, you can have high blood pressure. If you have high insulin, you're going to have diabetes, unless you have type 1. That's low insulin. But most people are type 2, which actually they have high levels of insulin. Inflammatory conditions is a situation where you have too much insulin. High cholesterol, too much insulin. Low testosterone, sleep problems, sleep apnea is high levels of insulin. Polycystic ovarian syndrome is high levels of insulin, which then converts to high androgen levels. And then mood disorders, whether it's depression, anxiety, is usually connected to blood sugars and high insulin. So as you do keto and insulin becomes lower, these medications become stronger. They have more powerful effects, and the need for medication goes down. Now, I just need to mention, don't ever come off medication without the help of your doctor. I'm not telling you to come off your medication. I'm just giving you data for you and your doctor to research, because you do want to work with a doctor that will help you reduce medication over time. There are certain doctors that have this idea that you will always be on this medication and there's nothing you can do to change it, and you just need to find another doctor, because most conditions do not require permanent medication for the rest of your life, especially if you find the cause. Okay, so there's a couple points you want to know about. If you're on insulin, for example, or even metformin, and you do keto, the need for that medication is going to go down. If you're still taking the exact same amount of that medication, whether it's metformin or insulin, you're going to end up with very, very low blood sugars, hypoglycemia, and you could actually have problems with that, because you don't actually want to take insulin, for example, when you have normal blood sugars, because it's going to push it down. The same thing with blood pressure. Generally speaking, you don't want to take blood pressure medication if your blood pressure is normal, because it's just going to push it down. You're going to end up with low blood pressure and feel dizzy and weak. So again, get with your doctor on this. But be aware that the doctor might not realize the importance and the power of keto on the body and in improving these symptoms. So you're going to have to basically bring things up. Hey doc, can you check my blood pressure, sugar and things, A1C, and just make some adjustments, because it's going to create a powerful effect. So it's nothing really to worry about. It's just something that you want to put attention on so you're aware of it. I guess another question that we can ask is this: will my medications affect my ability to get into ketosis? Okay, that is absolutely true, especially if you're taking insulin. Okay, that's going to block your ability to get into ketosis. If you're taking corticosteroids or prednisone, that will block your ability to get in ketosis. If you're taking estrogen therapy, that can block your ability to get into ketosis. There are certain medications with high blood pressure and high cholesterol that have a side effect of insulin resistance, which will then make it more difficult to get into keto. But the overall goal is to use this as a way to correct your diet and normalize body function, so the need for medication is not there. All right, thanks for watching. Hey, if you're liking this content, please subscribe now, and I will actually keep you updated on future videos.